Nutritional guidelines for epileptics. Many people suffer from seizures, and often, these seizures are caused by a condition known as epilepsy. Seizures caused by epilepsy can be repeated and/or prolonged and can cause a number of different sensations, depending on the type and severity of the seizure. The four most common types of epileptic seizures are partial, generalized, complex partial and grand mal. Partial seizures, only a small part of the brain is affected by partial seizures. Generalized seizures, a larger part of the brain is affected by generalized seizures, which may also cause a change, but not a loss, in consciousness. Complex partial seizures, unconsciousness can occur with complex partial seizures. Grand mal seizures, these are generalized seizures that involve motor systems in the brain, often leading to unconsciousness. The grand mal seizure is recognized by a clonic phase, slow, jerky movements, and a tonic phase, forceful contractions of the muscles. Other milder types of seizures include the petit mal seizure, which is also known as the absent seizure because it is often dismissed as daydreaming unless an accurate diagnosis is made. Epilepsy symptoms. There are many symptoms that epileptics can recognize as oncoming seizures. There are a number of medications to treat epilepsy, but these can cause harmful side effects. Other treatments include a change in diet and, as a last resort, surgery to remove the damaged brain tissue and implantation of a vagus nerve stimulator, a device that sends signals to help control seizures. Symptoms of epilepsy include double vision, noticing strange smells and/or sounds, falling, twitching or jerky movements, fainting, staring off into space without being aware of it, loss of muscle control. Treating epilepsy. It is possible that many patients with epilepsy have other related health problems such as brain tumors, stroke or brain infections. However, many epilepsy patients never know why they have epilepsy or other disorders involving seizures. In fact, many physicians test for other disorders to rule them out first, because epilepsy can mimic other disorders in its early stages. In order to treat epilepsy properly, it needs to be properly diagnosed, and with treatment, seizures may become less frequent and less severe. The ketogenic diet. The ketogenic diet is one that many physicians recommend for epilepsy patients. This is a diet that is high in fat and low in carbohydrates, because this type of diet burns fat rather than carbohydrates. The reason is that when the body burns fats, it creates ketones, which help to suppress seizures. This diet is usually prescribed by physicians for a period of 2 years, at which time other nutrients, including carbohydrates, are reintroduced. Because many of the nutrients that we need come from carbohydrates, protein supplements can be substituted to get the important nutrients that are necessary for survival. Because it is a high-fat diet, the ketogenic diet is one that needs to be seriously thought through before using it, and it should only be used under the care of a physician. Other diet no-nos for epileptics. Epileptics should be careful to avoid products with aspartame in them because it increases the risk of seizures. It also causes seizures in those with the metabolic disorder known as phenylketonuria, which does not allow phenylalanine, an essential amino acid, to be digested and work properly. People with epilepsy should also be tested for food allergies, which can trigger seizures. Some foods that are known to cause seizures include dairy foods, citrus fruits, wheat and certain food additives, such as benzoic acid and tartrazine. Knowing about these allergies makes it easier to treat them and reduce the risk of increased epileptic seizures. Protein supplements for epilepsy patients. Protein is a necessary macronutrient, one that the body relies on for survival. On restrictive diets, patients may not be getting the amount of protein that they need. To combat this, some physicians suggest that protein supplements be used in conjunction with the ketogenic diet, and a physician will know which supplements are best for each patient based on their medical history and possible food allergies and sensitivities. Some proteins, such as whey, a byproduct from the cheese-making process, are easier to digest than others. Soy and rice proteins are often recommended for those with many food allergies or lactose intolerances, and eggs have long been used as a source of protein. Many protein supplements, including powders and liquids, are made from these proteins. Another protein supplement that epilepsy patients may want to consider is ProfectR, from Protica. This is a small serving that really packs a punch of protein. At only 100 calories and with no fat and carbohydrates, ProfectR provides 25 grams of protein per 3-ounce serving. It also contains 100% of the daily recommended intake of vitamin C and 10% of the B-complex vitamins. ProfectR is available in many delicious flavors, including grapefruit mango, blue raspberry, fresh citrus berry and cool melon splash. A case study involving an epilepsy patient and protein supplements. When Cheryl began having mild seizures, she didn't think much of it. Then as the seizures became more frequent and more severe, she began to worry and made an appointment to see her doctor. After a number of tests, it was confirmed that Cheryl had epilepsy, and her entire life would change forever. Cheryl's physician recommended a number of lifestyle changes as well as many changes to her diet. He advised that she use the ketogenic diet along with protein supplements, including ProfectR. Cheryl purchased some ProfectR along with some protein powders that she could add to her favorite recipes and began using them regularly, both in between meals as snacks and even as meal replacements. Soon, with a combination of medication and a proper diet, Cheryl noticed that her seizures were decreasing in frequency and severity and that her life was beginning to return to normal. She no longer had to worry about seizures interrupting her daily routine and found herself becoming not only healthier, but happier as well. She continues to use ProfectR and is looking forward to the day when she can begin adding other foods with carbohydrates to her diet.